Okay, so now we're going to talk a bit about back pain. So what are some of the common causes of back pain? Well, we have muscle or ligament strain. We have herniated or ruptured discs. There's also arthritis, osteoarthritis, rheumatoid arthritis. We are also going to speak a bit about some abnormal curvatures of the spine. For example, scoliosis, lordosis, and kyphosis. And we'll touch a bit on osteoporosis, where your bone density is a bit less than usual, and in some cases, people also call this brittle bone. So let's speak a bit about muscular or ligament strain as a source of back pain. So those who are involved in a repeated heavy lifting, for example, construction workers, are at risk for back pain. If you work on a construction site and every day you are lifting heavy items, lifting sacks of cement, carrying a wheelbarrow, pushing a wheelbarrow, and you're having back pain, or even before you are having back pain, some sort of back protection in the form of a belt should be used. This will help to protect your back. The way in which a belt works is that when you put it on, it takes some of the load off the muscles and it transfers it onto the belt, so the muscles and ligaments don't have as much work to do. So that is the primary principle upon which a back support belt will work. Also, if you are overweight, it can exacerbate your current situation where you're having back pain. So also those who, for example, are in the gym and you lift weights explosively, doing deadlifts, clean and press, even squats, can put you at risk for back pain. Now, there's nothing wrong with lifting explosively. There's nothing wrong per se about doing deadlifts or squats. But the fact of the matter is, if you are unprepared to lift such weight and to lift weights that are too heavy, or lifting weights in an explosive manner, and your muscles and ligaments are not prepared for that, you are at a higher risk for back pain. Also, if you are in the gym frequently and you're not recovering, for example, you're not sleeping properly, this can also put you at risk for back pain, because with each gym session, there usually will be some micro tears in the ligaments or the muscles that need to be repaired while you sleep. So if you're not sleeping, or you are exercising too much and you're not getting adequate rest for recovery, you could be at risk for muscular strain or ligamental strain, which can then cause you to have back pain. Now, when you have a muscle or ligament strain, the spine basically straightens out. And what I mean is this. This is how the spine is normally laid out. Okay, this is a depiction of your lower back. There is normally a bit of a slight curve in the lower back, for example. When you have a muscular spasm or muscular strain, spine looks like this. So on the X-ray, you may actually see, instead of seeing this picture, you may see this picture over here. Okay, so let's keep that in mind. You can't see muscle on an X-ray. What you can really see here is the layout of the bones that are due to the muscles being in spasm. And when I say the layout of the bones are laid out in a straight fashion, as opposed to the normal curvature that would normally be seen in a person who does not have a muscular spasm. Okay, also those who work in office jobs, for example, and you are hunched over a laptop. So if for a large portion of the day, this is your body position, like this here, okay, this too can also put you at risk for muscle strain or ligamental strain. Also teachers who tend to lean over a desk a lot, and maybe you're marking papers for long hours, can also put you at risk for muscular ligamental strain, which can lead to back pain. Also, those who are on their feet for long periods of time, for example, security officers or police officers. Now, what happens here, it is the back muscles need to keep the torso upright when you're standing. Okay, your torso does not stand upright like this on its own. These muscles here, they have to contract to keep your torso upright. Without that muscular contraction, you would just flop forward, okay, in that sort of fashion. So standing up for long periods of time means that these back muscles here, you have to work for long periods of time on a continuous basis. And this can cause you to have muscular strain, muscular spasm, which is, again, a source of back pain. Also, to remember, with security guards and police officers, you're not just standing up, but you may also have gear on, for example, a bulletproof vest, a rifle, and this additional weight in the context of you standing for long periods of time It's going to put you at risk for muscular spasm, muscular strain, ligamentous tears, ligamentous strain. Okay, now we're going to speak a bit about herniated or ruptured discs. Now, this over here, again, I add the depiction of the spine. So here are your bones. The blue here, these are the discs. And the reason you have this here, the discs are there for shock absorption. Okay, so they're for shock absorption, they're for cushioning. For example, when you run or you jump off a height. So now these discs here, they have limits. Okay, so there's a limit to the amount of force that a disc can actually be able to bear. So if you exceed that limit, you can get rupturing or bulging of the discs. Also, too, there is a weakening of the disc as we age, and also a lack of activity can cause your discs to get weaker at a faster rate. Exercise is a great protector of the back. Proper exercise is a great protector of the back and the body generally. Okay, so what exactly am I speaking about when I speak about herniation or ruptured disc? So I'm just going to illustrate here. So the disc itself is composed of a thick tough fibrous ring with a soft jelly-like material at the center. That soft jelly-like material is mostly made of water. So here's your depiction of a disc. Here's the tough outer fibrous ring. Okay, we're looking at it just from the top now. And this here is your jelly-like or soft center that's there for the shock absorption. Now again, there are limits. So let's say you exceed the limit. Let's say you jump off a height or you lift something that's too heavy, and that is more than the disc is able to bear. What may tend to happen, two main things may happen. What you may have is that in that instance, the tough fibrous ring may remain intact, but the disc itself may bulge. So what you may get is a situation like this. Okay, so what we see here is some distortion of the tough fibrous ring, but it is intact, and this part bulges out. And what can happen here, if there is enough bulging, it can actually touch on a nerve, and that's what people call a pinch nerve. And when the nerve is touched upon and it is irritated, then you get sensations of pain, tingling, or even numbness. If it's very severe, you can also get limb weakness as well, as the muscular function falls because of the excessive nerve compression. So this is one situation. The next situation, which is a bit more severe, let's say in this case here, the ring itself ruptures or it tears. So, okay, so in this case now, it is not simply a distortion, but rather it is also a rupture or a tear of the disc. What you have here, it is leakage of that jelly-like fluid out of the disc. Okay, so this is a bit of a more severe situation, but those are two of the main things that can happen. Okay, you can have just a simple bulging, or you can have a rupture. Okay, now what may also happen is you can have a loss of disc height. So let me explain what that means. Okay, so this is a magnification or close-up of the disc. Here are the spinal bones, and here is the disc viewed from the side. So imagine you have this situation here where you have leakage of fluid due to a rupture. This here is a normal disc, and what you have here is actually a certain disc height that is present. Now imagine if you lose some of the fluid, what you're actually going to get is a reduction in the disc height. So on the X-ray or the MRI, this can become apart. So on the X-ray, you may not see, of course, you don't see the disc, but what you may see actually, the bones are a bit closer together. So instead of having this border all the way up here, the border may come all the way down here. So there will be a loss of this height. Okay. Also on the MRI, you may also see that loss of this height. On the MRI, you see a bit more detail, a lot more detail than the X-ray. When it comes to visualizing the spine in terms of the muscles, the disc, and the nerves, the MRI is your gold standard. Okay. Now, what we need to know is that not all bulges equal pain. Okay, it is quite normal for a lot of people to go to a doctor's office, say they have back pain, and for some reason they end up doing an MRI, and then on the MRI you see multiple bulges. So what you may see is something like this. So here's your spine again from the side. Here is your tailbone, and you have the disc here. Okay, and then on the MRI, what you may see are some slight bulges. Okay. Now, just because there is a bulge here, it does not mean that you have pinched nerve. It does not mean that the bulging is a source of the pain. Once again, there are many sources of pain. The bulging has to be to the degree where it is where it can actually pinch in a nerve to actually cause you some sort of pain. Nerve pinching by a disc is not the only source of pain, but I'm just saying it. Just because you see a bulge, it doesn't mean that that is the source of the pain that you're having. You can have many other sources of pain, and that needs to be properly investigated. Okay. Right, so let's talk a bit about arthritis. Then before we move on to osteoarthritis, let's talk a bit about rheumatoid arthritis. So in rheumatoid arthritis, this is an autoimmune condition. Okay, so as the name suggests, autoimmune, it is when your own immune system attacks you. Okay? In this situation, your immune system, it is not functioning well, and it is attacking your own tissues. And in the case of rheumatoid arthritis, it is attacking your synovial membranes, and we'll get into that. So to explain rheumatoid arthritis, the concept of rheumatoid arthritis, I'll talk about in the context of the hands, not the spine, but the principle, it is the same. So I'm going to do a little diagram here. We're going to do a bit of a magnification of this joint right here. Okay, so those here are the finger bones. And then, of course, on the finger bones, you have the cartilage. So I'm going to represent the cartilage with the red right here. Okay. Now, in between the joints here is something called your synovial fluid. Okay, synovial fluid, it is a lubricating fluid for the joint. So here's your synovial fluid. Now, what keeps the synovial fluid in place? Well, the synovial membrane, which seals off either side of the joint right here, is what is keeping this lubricating fluid in place. And then over that, you have the ligaments, which also add the structural strength to the joint. So here will be your ligaments as well. So it is this membrane right here, this synovial membrane, which keeps the fluid in place, that is attacked by the immune system in rheumatoid arthritis. And that is what causes pain in the finger joints, and if it is very severe, you get distortion of the joints. Okay? And sometimes when it's very severe, you know how the fingers tend to deviate to the side, and the joints get very swollen. Now, the same principle here on the spine also, in some of the joints, there are synovial fluid, as well as a synovial membrane that keeps the fluid in place. And in rheumatoid arthritis, your immune system is attacking the synovial membrane, and that is a source of pain. Okay? And if it is very severe, what you can also get is nerve compression and spinal cord compression in a situation where rheumatoid arthritis is severely affecting the spine. So now we'll talk about osteoarthritis. Osteoarthritis, we will abbreviate as OA. And in osteoarthritis, what happens is we need to speak a bit about the discs. So once again, I have the disc here. Here's the spinal bone or the vertebrae. And here's the disc. Now the disc is mostly water, and as we age, there's drying up of the disc, and then again the disc height will tend to fall. So instead of having this situation, what you have here, let's say the disc. Okay, it's not as thick as before. The disc height is not as great as before. And what tends to happen here? Now there are joints. There are the spinal bones, but there are other joints as well. So we have this here. Okay, so this notch here is the equivalent of this notch. So the next bone on top of it, this will fit into here. So this here is what is called a facet joint. Okay, it's called a facet joint. So as you can imagine, when you lose the disc height due to the drying up of discs, there's going to be a lot more pressure within this joint here, and there's going to be a lot more wear and tear. So in the picture of osteoarthritis, what you have is some loss of disc height and some additional wear and tear on the facet joint, and this here is a source of pain. Okay, now in this situation here, you can have nerve compression. So let's take a look at the vertebrae or the spinal bone from the top. Okay, so this here, that's the front, that's the back. This protrusion right here, that's the bone you feel when you put your hand right here. Okay, and this is the spinal canal. The spinal canal, of course, is where the spinal cord runs. So I'll put that in red. Okay. So that here is your spinal cord. And of course, the spinal cord, you have nerves that are exiting. Okay, and these are the nerves here that supply the limbs. So in the picture of osteoarthritis, what tends to happen is that you have some additional bone growth as well due to the inflammatory process. And the additional bone growth that occurs can actually narrow the spinal canal. The spinal canal that you see here. So if you have some additional bone growth, you can have some narrowing of the spinal canal. And as you can imagine, if you have the spinal cord running through a canal, and you have some closing off or narrowing of that spinal canal, there can be compression of the spinal cord. Okay, and that also can lead to pain. But also as well, the exit points. Remember, you have bones stacked upon each other. And again, if you have all sort of aberrant or erratic bone growth, the exit point of this nerve, the tunnel through which that nerve passes through, or what is called a foramen, okay, that's the exit point of the nerve right here. When that becomes narrow due to excessive bone growth in arthritis, you're going to have compression of that nerve. And the compression of that nerve due to the additional bone growth due to the arthritis can lead to a source of pain. What can also happen, let's say this is your disc here, this is the disc here. And if there is any sort of degenerative disc disease leading to disc bulging or disc herniation in the picture of arthritis, this here can actually bulge into the canal. And also that can be a source of canal narrowing. Okay, so this is the mechanism, one of the mechanisms, or a couple of the mechanisms in which arthritis can lead to back pain. Okay, so now we're going to speak a bit about the abnormal curvatures of the spine. Okay, and these abnormal curvatures can be sources of back pain due to poor loading of the spine, leading to wear and tear, and also muscular strain and muscular spasm as well. So what we'll speak about here, we'll speak about scoliosis. There's lordosis, and there's kyphosis. Okay, so we're just going to give some loose definitions here. Scoliosis here, it is that's a sideways curvature of the spine. Lordosis, that is excessive lower back curvature. So imagine that's the front, that's the back, and then let's say this is the normal curve of the lower back. And lordosis, which you have is excessive lower back curvature. Kyphosis has to do with the upper back. So again, the upper back has a certain degree of curvature. So let's say this is your head, that's your neck, and that's a normal upper back curve. Okay? That's your nose, that's your eye, that's the upper back curve there. When your upper back is curved excessively forward, that is called kyphosis. Okay? And as you can imagine, if the upper back is curved forward a bit more, it throws the head forward a bit more. Okay? This can also lead to neck pain as well. Okay? So scoliosis, lordosis, kyphosis, these are abnormal curvatures of the back. What they tend to do, they tend to put additional strain on the muscles because the weight is not being distributed properly due to the abnormal curvatures. And again, remember we mentioned that muscular strain is a cause of back pain. Okay, and these here are sources of muscular strain. They're also sources of excessive wear and tear on the discs and on the joint of the spine. So, for example, let's just take scoliosis, for example. So let's just say you're looking at the spine from the front, and the bones are stacked upon each other, in this fashion. Now, if you have a scoliosis or a curve in the spine, you can imagine that instead of the bones being stacked like this, it might be stacked like this. And this right here, this point right here, on the disc can be a point of excessive mechanical forces, which can lead to accelerated wear and tear, which again can lead to arthritis. Also, let's say, for example, the spine is curved this way. Muscles on this side of the spine can actually be under a bit more strain, and they can be overworked throughout the day. Okay, and again, muscular spasm, muscular strain, it is a source of back pain. So these are a couple of the mechanisms by which abnormal spinal curvatures can lead to back pain. Okay, so now we're going to speak about osteoporosis. Okay, so in osteoporosis, what we have is a situation where you have a reduced bone density. So everyone has a normal bone density. Let's just say your bone density should be at this level. As we age, and there is a reduction of the bone density if you don't maintain your body, especially. So let's say the bone density falls to this level here. Your bone density, of course, is related to the strength of the bones. Okay, and as a side note, if you have osteoporosis, you are far more likely to break your hip if you fall down. The average person with normal bone density is unlikely to break their hip because of a regular fall onto the side. Okay, when you're in your 20s, okay, what we have here is that's when your bone density and bone strength is at its maximum naturally. But as we age, there tends to be a reduction in bone density. However, you can keep your bone density, most people can, if you engage in resistance exercises, okay? So what happens is that resistance or mechanical loading is a stimulus for muscular strength as well as increased bone density. It is well known that athletes do have a higher degree of bone density than the average person. And this is on account of the training that they do, the physical training that they do. Okay, so in osteoporosis, what can sometimes occur are compression fractures. And we're going to just depict that here with a rough diagram. So once again, this is your spine. These are the discs. Okay, so in a case, for example, when an older person who has osteoporosis, for example, let's say they fall back onto a chair, and something as simple as falling back onto a chair can lead to a compression fracture in a person with osteoporosis. So the vertebrae, or the bones of the spine, they have a particular height. Okay, so let's say that's the height here of a vertebrae. And let's say an older person or a person with osteoporosis falls backward onto a chair. What you may see on the x-ray, after you report pain, when you go to the office and you do an x-ray, instead of the vertebrae having this normal height, what you may see is something a bit less. And then there may be a fracture line that can be seen on the x-ray. Okay, so this height here will be less than the normal height. Okay, so again, if you are caring for elderly people at home and there's a history of the person even falling back onto a chair, it doesn't have to be from a very high height. It can be a simple fall onto a chair, and the person then, after experiences back pain, is going on and on and on, and just does not seem to be going. You have to question whether or not the person may have had a compression fracture. And in that case, you're going to need to do an x-ray at least to elicit the presence of a possible compression fracture. If the person does have a compression fracture, it is advisable you see a specialist, maybe a neurosurgeon, to advise you accordingly. Just because you see a neurosurgeon doesn't mean that surgery is going to be done. Okay, the neurosurgeon is an expert in managing these conditions, and you really should seek the advice of a specialist. And in a situation where an older person is experiencing back pain after a fall. Okay, so I hope you enjoyed that presentation on back pain. It is just a general overview. If you want some more information, you can always contact us, and we will be happy to help you.